Hi, my name is Danielle Hausman. I'm an occupational therapist and rehab educator at the Craig H. Nielsen Rehabilitation Hospital. Thank you for watching this video about clean intermittent catheterization. Please take a moment to read this disclaimer and keep in mind that this video does not replace medical advice from your healthcare provider. And also keep in mind that these videos are updated frequently, so please make sure you're watching the most updated version of the video. Here are the objectives that we'll talk about today. So we'll talk about all the different things to consider when choosing a catheter for home supplies. We'll talk about the steps of clean technique, and we'll learn about how supplies will be obtained for home. So first, there's a lot of different things to consider when choosing an intermittent catheter, which can be overwhelming, but also is nice to have so many options that will work well for your life, and that's hopefully easy for you or your caregiver to use. So first, some catheters are firmer and some are softer. So for people that do have sensation around the genital area, sometimes a softer catheter can be more comfortable. But on the other hand, a firmer catheter has less of a tendency to noodle and coil as you push it into your body. And females generally use shorter catheters while males use longer catheters because male urethras are a lot longer. But sometimes females can find it helpful to use a male length catheter. And some catheters are lubricated with gel, while others are lubricated with a sterile water. And there is a lot of research that indicates that those that use catheters with a sterile water as opposed to gel have less trauma to the urethra and less urinary tract infections over time because the sterile water is a much thinner solution compared to the gel. And some catheters will stay wetter for a longer duration of time than other catheters. So if it takes you a longer period of time to catheterize, it might be helpful to have a catheter that has a water solution that's going to stay wetter for longer. And sometimes it just comes down to packaging, that certain packages can be easier to open compared with other catheters, and also some packages are much smaller and more discreet and easier to carry around in the community compared to others. And some catheters have a straight tip, that's the majority of catheters, but for men that might have some swelling around their prostate, they can use a special tip catheter that's called a Coude catheter, meant to navigate through a swollen prostate. So it's important to talk to your doctor to see what kind of a tip you should be using at the end of your catheter. And unfortunately, there can be some insurance limitations, so just work with your healthcare team to know which catheters will be covered by your insurance. So next we'll go over the steps of clean technique. And this is a little bit confusing because when your nurse caths you in the hospital, they use what's called sterile technique. And they use sterile technique in an abundance of precaution since nurses go from patient to patient throughout the day. There's a high risk of other patients' germs getting inside of your body, but not when they use sterile technique. And when you're learning to cath yourself, since you're certainly not cathing anybody else, there's a lower risk of this happening, and so it's okay to use what we call clean technique. And so with clean technique, you don't need to use gloves. So we'll talk about the specific steps. So first you need to clean your hands, and this can either be with soap and water, with a baby wipe, or hand sanitizer. And step 2 is to clean your genital area, and then open up the package of the catheter, but without touching the catheter itself. And then you need to clean your hands a second time, and the purpose of this second hand washing is to clean off whatever germs got on your hands from cleaning your genital area and from opening up the catheter. And next, you insert the catheter into the urethra until urine starts to drain, and then let the urine drain out. And then at that point, you're not quite done yet. Then you insert the catheter about in an additional 1/4 inch, just because sometimes urine will pool in the bottom of the bladder. And then last, remove the catheter. And when you remove the catheter, you want to take it out very slowly so that it doesn't cause any trauma to the urethra as you're pulling it out. So next, we'll do a short demonstration. So after you've completed the steps of hand hygiene, you insert the catheter into the urethra, and you want to try to hold the catheter as far down as you can. And this is with a Coude catheter. And insert it until the urine starts to drain. And you want to try to touch the catheter as little as possible for the part that will be going into your body to decrease the risk of germs. And then once the urine stops to drain, insert it about that additional 1/4 inch and then remove it slowly. And we follow the same process for a female. So just insert the catheter, let the urine drain, additional 1/4 inch, and remove very slowly. So here are some important points to help prevent infection. So of course, if the catheter drops on the floor, you definitely want to start over with a clean catheter and then just start from the top as far as the steps of cathing that clean your hands again and follow all of the hygiene steps. And you should never feel like you're having to force the catheter into the bladder. That if you feel like there's a lot of resistance, this indicates that there's a problem and you want to call the doctor right away so that it doesn't cause any further medical complications. And it's important that catheters should never be reused, that it used to be old practice many years ago that we had to sterilize and reuse catheters, but doctors have recognized that this causes a very high risk of infections, and so catheters are now meant to be one-time use only, where we use a new one every single time. So for ordering your home supplies, in most cases, you'll be set up with a distributor before you leave inpatient rehab, and the distributor will mail the catheters to your home, and these will be very large shipments. The catheters will come in supplies of 1 month's worth at a time. And the one exception to this is if you have home health and Medicare is your insurance. And so in that case, your home health company will provide the catheters. And it's important to know that you certainly can change your mind as far as what type of catheter you're using after you go home. That something might work well while you're in rehab, but after you go home, you might change your mind. And in that case, you just work directly with your distributor and your healthcare provider to get a new prescription and change the type of catheter. So to summarize, we want you to have the time on inpatient rehab to explore the many different types of catheters that are available to find what's going to be easiest for you and or your caregiver to use. And we also want you to have plenty of time to practice clean technique so that by the time you go home, you feel really comfortable with it. And at the same time, it's also important to make sure that we're deciding on which catheter you're going to use at home to make sure that the supplies will be ready for you in time before you discharge from the hospital. Thank you for listening to this video. And as always, please let your primary care team know if you have any questions.